So I'd just like to say a few words about conflict of interest. And this is often a perception when people from the pharmaceutical industry and people from the Public Health Centre, for example WHO, are in discussion together, are involved in decision-making processes, are involved in licensure and development of vaccines. So actually I wanted to say two things. So first of all, I think actually it's extremely healthy and actually essential that when we're responding to a new disease or responding to a public health need, that manufacturers and governments and public health agencies are talking to each other. Because it's only by actually understanding each other's needs and constraints that we can actually work together. So it's actually very healthy. So how do we avoid conflict of interest? I think the important thing is complete transparency. So as long as there is full transparency, that manufacturers declare exactly what their interests are, what their links are, what their presence is, when they are involved in these discussions, I think we can absolutely mitigate the risk of that. And we have to, of course, appreciate that conflict of interest happens not just in interface between industry and between governments. It happens, for example, in academic departments where there's a conflict between the need to publish and the need to do good science. So I think conflict of interest is a fact of life. The important part about it is declaration and full transparency.